Sulfonamides are a class of antimicrobial agents that act as a competitive antagonists of para-aminobenzoic acid. They inhibit bacterial synthesis of folic acid, which is essential for DNA, RNA, and protein synthesis. Adequate hydration, monitoring for adverse effects, and awareness of drug interactions are essential for safe and effective use of these antibiotics. In this video, we will discuss some important clinical pharmacology pearls about these sulfonamides. So let's get started. Number 1. Allergic reactions. Sulfonamides can cause allergic reactions, ranging from mild rashes to severe conditions, such as Stevens-Johnson syndrome and toxic epidermal necrolysis. So, patients should be monitored for any signs of hypersensitivity reactions. Number 2. Crystalluria. Sulfonamides can crystallize in the urine, leading to potential renal complications. Adequate hydration is crucial to prevent crystalluria and maintain urine flow. Alkalinizing the urine may also help prevent crystalluria. Number 3. Photosensitivity. Sulfonamides can cause increased sensitivity to sunlight, leading to sunburns or rashes. Patients should be advised to use sun protection and avoid prolonged sun exposure. Number 4. Combination therapy. Sulfonamides are often combined with trimethoprim to enhance their antimicrobial activity and reduce the risk of resistance. This combination, known as cotrimoxazole, and it is particularly effective against a broad spectrum of bacterial pathogens. Number 5. Drug of choice for pneumocystis jiroveci pneumonia. Cotrimoxazole is the drug of choice for both the treatment and prophylaxis of pneumocystic pneumonia infection in immune-compromised individuals, particularly those with HIV or AIDS. Number 6. Drug interactions. Close monitoring of INR is required when sulfonamides are used with warfarin due to the risk of increased bleeding. So dose adjustments of warfarin may be necessary. Cotrimoxazole can also enhance the toxic effects of methotrexate due to deficiency of folic acid. In summary, sulfonamides are effective antibiotics that inhibit bacterial folate synthesis and used for treatment of a variety of infections. While generally well tolerated, they have significant drug interactions and potential for severe allergic reactions. Adequate hydration, monitoring for adverse effects, and awareness of drug interactions are essential for safe and effective use. Thanks for watching. If you found this video helpful, let us know in the comments below which drug class you'd like to see clinical pearls on next. Keep learning, keep growing, and see you next time. Thank you.